Chapter 8, Heart and Blood Vessels, Screencast 2. Now, Screencast 1 focused primarily on an introduction to the structures and the anatomy of the vessels and heart. Now, Screencast 2 will be focusing on the mechanical aspects and how the heart actually works. The first thing that we're going to talk about is the cardiac cycle. Now, the heart works in a very coordinated and cyclical manner. It contracts and relaxes. Now, atrial systole, both atria contract at the same time. The AV valves open, the semilunar valves are closed, and this results in the ventricles filling. Now, ventricular systole, this is when the ventricles contract. At this point in time, the AV valves close, semilunar valves are open, and this is when blood leaves the heart. Now, diastole is both atria and ventricles are relaxed, and the semilunar valves are closed. Now, we can see this in that diagram here. So once again, here's an overview of the chambers. During atrial systole, both atria are going to contract, and that causes blood to move into the ventricles. Now, the majority of ventricular filling is actually passive, because the pressure in the atria is greater than the pressure in the ventricles, and that causes the AV valves to be open and blood moves passively. Now, as the atria contract, that's how the ventricles get to their maximum filling. Now, during ventricular systole, both ventricles contract. This causes the AV valves to close and the semilunar valves are opening. This is also sometimes known as the ejection phase, and blood is actually injected into the pulmonary trunk and the aorta, and at this time the atria are relaxed. Now, one thing to keep in mind, typically when we look at the amount of time that the heart spend, most of it is actually in diastole. So I kind of have an issue with this diagram here because it kind of shows equal amounts of time, but let's kind of keep that in mind. At rest, the heart spends more time in diastole than it does in systole, and typically when we use the term systole, we refer more often to ventricular action, so ventricular contraction, and that's how I like to use those terms. So unless I say otherwise, when I'm talking about systole, I'm usually talking about the ventricles, Now, there's also heart sounds. So when you're in the doctor's office and the doctor takes a stethoscope and wants to listen to your heart, really what they're looking for or listening to are the closing of the valves. And there's actually two sounds. There's a lub and a dub. The lub is the closing of the AV valves during ventricular systole. The dub is the closing of the semilunar valves. Now, you may know of someone that's been told that they have a heart murmur. Now, a heart murmur is what happens when blood flow is disturbed, and usually it's an issue with the valve. So there's actually regurgitation, and blood is typically moving in the wrong direction. Now, these can be fixed surgically. You may have heard of someone getting a valve replacement, and that's generally what's happening to replace a defective valve. Now, the other thing that's really important for us to remember here, and I alluded to this earlier, cardiac muscle is actually what we refer to as myogenic. And what that means, it generates its own electrical signal for contraction. So what I like to say quite often, electrical first, mechanical second. So these electrical events are actually responsible for the mechanical or contractile events. So one of the things that you want to be comfortable with are the structures that make up what we call the conduction system of the heart. Now, it starts off over here. This area is called the sinoatrial node or the SA node. That is the pacemaker. And what happens here is this is where the heartbeat is initiated, and it happens spontaneously. Skeletal muscle is neurogenic because it actually requires a signal from a motor neuron. As noted, the heart generates its own electrical activity, so you may hear the term autorhythmic to describe the electrical activity of the heart. Now, then the next structure is the AV node, okay? And that's located between the atria and the ventricles. And now we're talking about the relay of the impulses. Then I have the AV bundle and bundle branches, and then Purkinje fibers, okay? Now, they're located within the septum and the ventricles, and they carry the electrical impulses to the ventricles, and it's actually the electrical impulses that cause the ventricles to contract. Now, here, okay, you may have had an EKG done, and what an EKG does, it actually records the electrical activity of the heart itself. Now, generally what we're going to see, a healthy heart is going to produce a very characteristic pattern. And here, there's basically three formations. We have the P wave, the QRS complex, and the T wave. Now, one of the things that I'm going to ask you to know, what is happening electrically during these waveforms. Now, the P wave, okay, that is atrial depolarization. The QRS complex, that's ventricular depolarization. And then the T wave is ventricular repolarization. So you may be asked to identify what electrical events are associated with the P wave, which is atrial depolarization, the QRS complex, which is ventricular depolarization, or the T wave, which is ventricular repolarization. Now, the EKG is only capable of detecting electrical events. So arrhythmias, which are an abnormal arrhythmia, and what they're showing here is actually a very lethal arrhythmia. This is ventricular fibrillation. So those of you that have first responder CPR, you probably have learned how to work an automated defibrillator. And what that automated defibrillator actually does, kind of think of it as rebooting the operating system or the conduction system of the heart itself.